Bear with me, I'm a little nervous. I spent the last hour pacing back and forth outside the hospital, and I looked down, I was like, man, I got my 10,000 steps in a day. Well, my name is Anthony Gordon, and I'm honored to be here today representing SSM Health, St. Anthony's Hospital in Oklahoma City, specifically the Accents Program in the Behavioral Medicine Center, where I work as a mental health tech. The great philosopher Plato once said, "The first and best victory is to conquer self." Today, I'm going to talk about how I use this philosophy to remain calm when dealing with an angry patient, and how my perspective has served me in times when negative energy wants to dominate the moment. Accents is a psychiatric unit consisting of children and adolescents that at this time are unable to display socially appropriate behavior due to mental illness coupled with cognitive delays. On top of that, many of our patients come from abusive situations. One of my passions is helping our patients overcome these obstacles and learn to enjoy being part of a team. That team not only includes the patient, but also the program doctor, counselors, recreational therapists, nurses, and other mental health techs like myself, who assist them in learning how to function with mental illness and instill a sense of hope and value. Working on a psych unit is the ultimate test of how well you can control your own frustration. During the course of a work week, I may be hit, kicked, spit on, called racial slurs, screamed at, urinated on. I've even had feces thrown on me. While that doesn't sound like a job to jump out of bed and rush to, my team and I have seen firsthand the impact that we've been able to make in many of these kids' lives. I've grown to appreciate the challenge of maintaining a controlled spirit, keeping in mind that I have not been where they have, nor have I had to endure some of the issues these children had to encounter. I've heard that all actions are simply needs trying to be met. So if I lose control of my emotions, I may never discover the patient's need and will fail to give excellent care. You have to slow down. Don't be so quick to react. Put yourself in their shoes. Ask yourself, are they scared? Are they still reacting to the current traumatic event or something bad that happened to them in the past? Maybe they're just tired. You may never know the reason, but in order to fully help, you have to learn to treat them with respect, even if they're not treating you with respect at that moment. One of my most challenging and favorite kids to work with on the unit right now is a boy we'll call Jay. That's not his real name. He's one of my favorite patients because he's very helpful. He keeps his room clean and organized on his own, and he has a smile that brings a joy to my heart. When he first came to Accents, he would have anger outbursts pretty much on a daily basis and would begin assaulting anyone near him to the point of requiring a therapeutic hold. This is a technique we're trained to do in order to keep others around him safe as well as himself. In the past, I myself have been the target of his assaults, and he would not tell me what angered him. Through all this, I was careful to remain calm. As Plato put it, I have learned to conquer myself, and that allows me to tune in to what our patients need. I've noticed that recently, Jay is not having as many outbursts and is not as aggressive toward me as he once was. he is beginning to open up and show signs that he can trust me. For example, the other day he became angry and had to take a time out. While taking the time out, he reached out and lightly hit me. Now, it's important to know that in the past, he would have walloped me. As I began to talk to him, he stopped being aggressive and began to listen, which for him is a victory. He also told me why he was angry, which again is a huge success for him. Because he was not willing to do that when he first arrived on the unit. And eventually, he was able to calm down and return to class. As I was preparing this presentation, an old Jermaine Jackson song popped in my head that goes like this. Don't take it personal. Take the bitter with the sweet. Easy come, easy go. These things don't come easy. It takes time and a whole lot of patience to learn how not to take it personal when a patient is lashing out. And it takes even more time and patience to stay calm long enough to see real improvement in a challenging patient. At times, when you're being hit and kicked and cursed, it may seem all bitter with very little sweet. But the things that don't come easy are often the things that are most worth doing. So don't take it personal when somebody's giving you a hard time, whether it be a patient, a coworker, or someone in the community, or perhaps even your own spouse. I'll admit I haven't mastered that one yet. I'm close, though. And I'll keep working on it because I have seen the value firsthand. Have patience. Stay calm. And try to conquer yourself enough to really see the needs of those around you. If we can truly learn not to take things personally, we will have a better chance of controlling our own emotions. In doing so, not only will we experience a happier life, but we will have cultivated a virtue that will serve us and all the people in our lives for years to come. Thank you.